What are the 5 ways to treat keratoconus without surgery? I'll be talking about the 5 best ways in this video. Hi, I'm Dr. Thanh Mai from Insight Vision Optometry. So what are the 5 best ways to treat keratoconus without surgery? The first one might seem a little bit obvious, but it involves just wearing a pair of glasses. Now, if you have very mild keratoconus, sometimes a pair of glasses is just the least invasive, most convenient way to see clearly without anything more. So let's talk about making the right pair of glasses. Now, if you're going to a place and they have you put on a pair of glasses and they take out a little pen and just kind of mark it up, and then they use like literally a handheld ruler to make your glasses, that is not good enough today. That was good, those are grandpa's glasses, but today, especially with keratoconus, you need lenses that are a little bit more customized and that have much better optics than the glasses of old. So what I recommend is this. When you're making the glasses, ensure that the place you're going to is going to make digitally designed glasses. Ask them if they're digitally designed glasses made by computer software. When they're taking the measurements, they shouldn't just be using a handheld ruler and some pens. They should ideally be taking an image of you wearing the frame, and that image is going to help to determine lots of different factors about the frame to make sure you have the right lens. For instance, the pentoscopic tilt, how much the glasses tilt forwards and back like this. The wrap of the glasses, which is how much the glasses are going to wrap around your head this way. How far are the lenses from your eyeball? Are they glasses that are down your nose? Are they closer? All those things matter in terms of making the pair of glasses. By taking the custom measurements with the frame on, with digital markers, it will design a lens that's much more custom made that gets you better vision in the center of your vision and also in your peripheral view that can best treat your keratoconus with a pair of glasses. That's just to take the measurements to make the glasses. The second thing you have to look into as well is the material. Usually, if you have keratoconus, you've got a high prescription. In fact, you're usually very nearsighted. So the lens material you want is usually not the cheaper plastics, but either a polycarbonate Trivex or usually a high index lens. The high index lenses are able to be lighter in weight and thinner so that when you're making the glasses, they just turn out better. Another consideration is what kind of coating you have on the lens. Light naturally will bounce off surfaces, and when it does, when it bounces off the surface of your glasses, it can cause a lot of glare. By having an anti-reflective coating, it will cut down on that glare, let the light reach your eye more comfortably, and certain coatings can also reduce smudges and dust on the lens, and even block harmful blue light from screens and digital devices. So these are all the considerations you need to look into when you're getting a pair of glasses. 1, was it digitally designed with special measurements instead of just a pen and a ruler? 2, what kind of lens material is it? Is it a high index material lens that matches a high prescription so it's thinner and lighter in weight and has better optics? And lastly, does it have the right coatings to reduce the glare that reaches your eye? The second best way to treat keratoconus involves soft contact lenses. Now, if you're lucky and you have very mild keratoconus, the general run-of-the-mill soft contact lens that you can throw away on a daily basis can work for you. Only if you're very mild though. Unfortunately, if you're watching this video, you might have more of a moderate to severe case of keratoconus. In that case, the general run-of-the-mill soft contact lens might not work for you. In this situation, you might want to ask your eye doctor about more specific options. For instance, 2 of the ones that we do in this office are the Keratoconus contact lens and the Novacone soft contact lens. Both are much more different, much more custom made than the general run-of-the-mill soft contact lens that is specifically designed to treat patients with keratoconus. These patients that wear the Keratoconus and Novacone, they get a little bit best of the both worlds. The lens is very comfortable versus perhaps wearing a hard contact lens, but the optics are superior than wearing simply a pair of glasses or the general run-of-the-mill soft contact lenses. The third best way to treat keratoconus involves wearing a rigid gas permeable lens that's usually no bigger than the colored part of the eye that you see. What this does is you apply a hard contact lens to the front surface of the eye, And the beauty of the hard contact lens is now your eye is the shape of that lens instead of the shape of an eye that has keratoconus. The reason why patients with keratoconus cannot see very clearly is because the eye is an abnormal shape. By wearing a hard contact lens, your eye now becomes the shape of the hard contact lens. They're very simple to apply and remove. The vision is normally extremely good. There's only one reason why, in fact, most people can't wear this hard contact lens is the fact that the lens is a little bit uncomfortable. The reason why it's uncomfortable is when you blink, the eyelids hit the edge, the hard edge of the gas permeable lens. When you blink and you hit that hard edge, you might feel it. Now, the good news is that the majority of patients, after wearing for 1 or 2 weeks, get used to it and do just fine. Unfortunately, there are some patients who cannot, in which case now we need to talk about the 4th and 5th best correction options for keratoconus. The 4th best way of treating keratoconus without surgery involves wearing a hybrid contact lens. It essentially marries a soft contact lens with a rigid gas permeable lens and puts them together. The center part is hard and the skirt around the center part is soft. Because I mentioned before, the main reason why patients don't do well with the small hard contact lenses is because it's not comfortable when you blink. So this gets around that problem by making the edge soft. So when you blink, it just hits that soft edge and is much more comfortable. At the same time, the optics of the middle, since it's hard, is better than wearing a soft contact lens, which doesn't treat the corneal irregularities as well optically as a hard contact lens. Now, why don't a lot of patients wear hybrid lenses then? Why doesn't everyone wear them? The problem that some patients have with the hybrid contact lenses is that the skirt, especially when the eyes get dry, can sometimes suction onto the eye extremely tight. I've had situations with patients that it is so tight, it is almost impossible to remove those contact lenses without using like forceps. They literally could not remove them from the eye. The 5th best way of treating keratoconus is in fact the most popular. And if you're watching this video, you've probably heard of it. And it is a scleral contact lens. A scleral contact lens is fit on essentially probably 80 to 90% of the new patients that have keratoconus in our office today. And it's growing in popularity across the country because it has the best of all worlds. The lens is extremely comfortable to wear all day long, and it gives by far the best vision optics of essentially every option we've previously discussed. So what is a scleral contact lens? We call it a scleral contact lens because it sits on the sclera. The sclera is the white part of the eye versus the cornea is the middle part of the eye, which is over the iris. So these contact lenses are bigger. They sit on the white part of the eye. In fact, they do not even touch the central cornea at all. They don't touch your cornea. They vault the whole thing. And that's another reason why we're fitting them so much. We want to avoid things rubbing up on the cornea. We believe that potentially rubbing the eyes a lot might contribute to making keratoconus worse. And so we would naturally want to design a lens that doesn't touch the cornea, hence scleral contact lenses. They sit only on the white part of the eye, they vault the middle part, and now your eye is essentially the shape of the scleral contact lens. It helps to ignore the irregularities patients have when they have keratoconus, the abnormal bulging, the thinness, the difference in size on the bottom part of your eye than the top part of your eye. What the scleral lens does is it basically resurfaces the shape of your eye to a shape that's much more regular. The beauty of wearing scleral contact lenses as well is that they're very comfortable. When patients blink with other hard contact lenses that are smaller, it feels uncomfortable because when they blink, they hit the edge of the lens. With a scleral contact lens, the lens is larger, the eyelids sit on top of the lens already, and so when they blink, they just glide over the front surface of it. They don't feel that hard, uncomfortable edge, and the lens should be very comfortable and they'll barely feel it. Another reason why patients love scleral contact lenses is that the #1 reason why patients fail with contact lenses in the United States has to do with a problem called a dry eye. When your eyes are dry, it's very hard to wear contact lenses. What scleral contact lenses do is they cheat a little bit. We actually will fill the bowl of the contact lens with solution and put it on the eye. In fact, let me go get a few samples right now and show you what I mean. So I wanted to show you some examples of contact lenses that you might encounter at your visit with the eye doctor. The first one is the soft contact lens I mentioned. These are the most popular form around the world, the soft contact lenses. And what happens is it's a lens that is very soft. You see how squishy that is? I can basically maneuver. It's like it's a very, very soft piece of plastic that can morph and is very squishy and and changes shape very easily. It won't hold its shape. It will essentially become the shape of your eye if you put it on. And so the good news is that it's very comfortable to wear, but the problem is that again, it doesn't retain its shape. It'll become the shape of your eye, which will not correct for all the problems inherent with keratoconus, which is that your eye is a weird shape, right? But at least this is the first version, soft contact lens. This one here is the corneal rigid gas permeable lens. It's called a corneal rigid gas permeable lens because it fits right on the cornea, so it touches the cornea. It's roughly the same size as the cornea as well, and it's a lot smaller than the other two options. The beauty of it being smaller is that it's much easier to apply and remove. But again, because when we're blinking, as we're blinking, we literally blink like this, and when we blink, we hit the edge of the lens. And it's that edge of the lens that's a little less comfortable. And this here is the scleral contact lens. See, unlike the soft contact lens, when I try to squeeze it, it doesn't change shape at all. It stays the same size, and I can't squeeze it up like a taco like the other ones. So it remains the same shape, so it has better optics than soft contact lens. Now, also the good thing about it is that it's bigger. It's much larger than the rigid gas permeable lens that fits over the cornea. Because it's bigger, when I blink, I don't blink and hit the edges. My eyelids are already going to be over the edge as I blink, and so it's much more comfortable when I'm wearing it. Now let's say you decide you're going to get a rigid gas permeable lens. Let's say you're going to get a corneal gas permeable lens. You want to make sure that the lens that you get is the right type. So first of all, you want to make sure that the lens is designed appropriately to match your eye. So a few things that you need to watch out for when you go to the eye doctor. When you go to the eye doctor, you need to make sure that that doctor has a corneal topography. A corneal topography looks like this. What a corneal topography is that it measures the shape of the front part of the eye. Red spots are usually parts of the eye that are steeper. Blue parts of the eye are usually parts of the eye that are flatter. So think of it like an island. The blue part is like sea level, like water, and out comes the red or green colors that is like the island. So if the doctor that you go to doesn't have a corneal map of your eye, probably not the doctor for you, because in order for them to design the right contact lens, they need to know what the shape of your eye is before they can move forward. The second thing you want to ask is that doctor design the lens using digital designed lenses based on this topography measurement? Or are they just using a fitting set? If they're just using a fitting set and doing guess and check, it's not going to be as accurate as a doctor that's going to take this map and use it to custom make your lenses based on the shape of your eye. Because it can be literally one-to-one nowadays. It should be less trial and error and more science. We can nowadays just take this map, send it to a lab, have it custom made to match your eye perfectly, so the lens is much more comfortable. The doctor needs to be able to take this topography measurement, and they should be able to import it into software like this that we can use to map out and design the shape of your lens even before we see it on your eye. We should have an idea of how it's going to look and how it's going to sit on the eye even before we order it, based on what the software recommends. Whatever doctor you go to, you want to make sure they also have the ability to capture what the lens looks on the eye and how it's fitting, and be able to capture and take a video of it, because a picture is worth 1,000 words. So a doctor should be able to, for instance, this is an image of a patient wearing this contact lens. We've applied a green colored liquid to the eye so we can see how it seeps underneath it. So we can find out what the shape is in terms of where the lens is touching the eye, these black parts, and where the lens is vaulting and not touching the eye, which is these green parts here. But the main takeaway that you want to learn is that the doctor you go to needs to be able to image how the lens sits on the eye. They shouldn't just be looking at it with their eye and just moving on and trying to fit by trial and error. They should be capturing the images with software and designing it based on what they see from that. Another thing that you want your doctor to be able to do is that many patients fail with contact lenses. They get red and irritated eyes, the lens fog up on them because they have a dry eye problem. If you have dryness in your eyes, or your tears are not good, or if your eyes are just getting really red at the end of the day, you might have a dry eye problem. And in order for the doctor to determine how to fix it, they need to be able to image the glands of your eye. And so this is a picture of a patient. We flipped their eyelids. We've taken an image of their glands. You see the glands here, these little white little lines or little streaks there? That's a picture of us imaging a patient's oil glands to determine if they have a dry eye problem or not. If your doctor is not imaging your oil glands, they won't be able to determine potentially what's causing your redness and discomfort with wearing contact lenses of any sort, whether or not it's scleral contact lens or rigid gas permeable lenses. So make sure your doctor can also image your oil glands to determine if you have an issue with your tears that's causing a problem with your contact lenses. Now, what I showed you before was a map of the cornea. That was a corneal topography, which we use to design lenses that sit on the cornea. That's the smaller one, right? That's the smaller one that sits over the colored part of the eye. It's much smaller than both a soft or a scleral contact lens. Now, let's say you're getting a scleral contact lens though. You want to make sure your doctor is very proficient in fitting scleral lenses. You'll know if a doctor is fitting scleral lenses and if they do it regularly, if they have now a scleral topography. A scleral topography is where they'll take an image, not just of the center part of the eye, but here's an example of us taking images where we take 3 pictures where the patient's looking straight, looking up, looking down, so we can capture more of the white part of the eye. We take the images of the white part of the eye, and what we do is we can look at the shape of it here and determine what the shape is of the white part of the eye, called the sclera. From there, we can take these maps that are in 3D and we can design a scleral lens that matches the shape of not just the cornea, but the white part of the eye, called the sclera as well. If you don't have a correct fitting scleral contact lens, it can cause a lot of redness. You'll have a lot of foggy vision at the end of the day. The lenses will just not be as comfortable because they're not custom fit. So if you're going to get a scleral contact lens, one thing to ask the doctor is, do you have a scleral topography? Are you going to map out the shape of my sclera before you design a lens? If they don't know the shape of your sclera because they haven't measured it, then it's very hard for them to design the right contact lens with a lot of guesswork, a lot of guess and check. And when you're trying to treat your keratoconus, you don't want a doctor guessing. You want a doctor that has the highest level of technology to map out the shape of your cornea, the shape of your sclera, the shape of your entire eye to determine the exact contact lens that will fit for you. So if a doctor is going to be fitting scleral lens on you, you want to make sure the lens is fitting appropriately. One of the best ways to determine if the lens is fitting appropriately is using a device called an OCT. Essentially what an OCT does is it takes images of your eye with a lens on, where we can actually see how it's sitting on your eye right there here. So this is a picture of the center part of a patient wearing a scleral contact lens. Here we can see that cross section. The bottom part's their cornea. This part in the middle is the space between the contact lens and the cornea. And the top here, this part right here, is the scleral contact lens. In this situation, we measure it in a lens that has basically about a little bit over 500 microns of clearance between the back of the lens and the cornea. We know that because we took an image of this. If the doctor is not taking an image like this, they might not be able to see it as clearly and measure it as accurately if they have an OCT. So ask your doctor if they're doing OCT images of the scleral lens on your eye when you're running into any problems, and this will help to troubleshoot how the lenses fit. So the take-home message is, if you're going to get glasses, make sure they're digitally designed glasses. Basically, the optician is not just using a ruler and some pens. It should be imaged on the eye that matches the frame for you. It should have the right lens material, which is usually high index materials or Trivex. It should have the right coatings to reduce glare and smudges. If you're getting soft contact lenses, make sure your doctor is familiar at least with the custom soft contact lenses for patients with keratoconus. For instance, there are two types at office here, the Kerasoft contact lens or the Novacone contact lens. Both are specifically designed for patients with keratoconus. If you're getting a corneal rigid gas permeable lens, make sure that the doctor that you go to is mapping out the shape of your cornea and is able to design it based on that topographic reading and not just guessing, but actually using a map, designing with software so it matches your eye custom made. If you're doing a scleral contact lens, ask your doctor and make sure your doctor is mapping out the shape of the sclera, usually with scleral topography. Make sure your doctor also has an OCT in order to image how the lens is actually sitting on your eye after you receive it to make sure it's properly vaulting the middle part of your cornea. Also make sure it's landing on the sclera correctly, and they should be able to image those parts and show you on a 3D picture how it actually looks on your eye to make sure it's fitted appropriately. So that wraps up the 5 best ways to treat your keratoconus without surgery.